You may be asking yourself, why should you choose us to help with your dental health needs or overall health needs? Especially when you can drive down the street and probably drive by 7 dentists in a 2-mile radius. I feel like we have a very unique service to offer here, and I praise God for the things that we've learned and the people that have assisted us in putting together what we're doing. It's kind of unique in our country to have a dentist and a naturopath practicing together. And I'll tell you, as many wonderful things as we've learned, we still haven't reached our potential. We're learning new things every day that give us more insight into how we can help people to heal better and how we can help them to recover better from things that they've been challenged with. I feel that, initially I didn't really have the tools that I needed in order to really serve patients to the level that I wanted to. I've always had a desire to want to help people, but I was just aware emotionally of all the stress involved. Having relatively regular care as a child, I never, and being blessed with pretty good health, I didn't have a lot of the bad dental experiences that a lot of my patients have. And I really had a hard time at first understanding. All I could tell on a feeling level was that people were very hurt, people were very mistrustful, people were very frustrated, and people were very afraid. And it took me some time to start to get down to what I could actually try to do to help patients. I was given a book by a dear friend called Human Lifestyling. It's no longer in print. But it really opened my eyes with respect to how dentistry and overall systemic health relate. It talked about in this book how they observed in the blood chemistry analysis of certain patients that never got cavities, never had oral disease. They always noticed the same ratio of minerals, like calcium and phosphorus. They were always in the same perfect relationship to each other. That blew my mind. I didn't understand why that would have anything to do with somebody getting a cavity. I was taught that cavities were a result of not brushing. Cavities were a result of people eating too much sugar. So I didn't understand why those things would influence health. What I knew, though, is that I had to get more prevention into my practice for my patients because everybody was coming apart at the seams with stress related to dental work. That's when I realized and started doing research and realized that the missing key in my practice was a naturopath.
As a naturopath, we're taught to get to the root cause of the issue, to do more preventative care than reactive care. Our country and our society looks at reactive care as a model for health care and are more comfortable with possibly taking a pill to deal with pain or discomfort and kind of band-aid a situation. As a naturopath and with a holistic look at health care, we're always taught to get to the root cause of why you would have the pain. You certainly don't have a headache because you have a lack of aspirin, in your system. It could be a mineral deficiency. It could be stress. It could be a lot of different things that would lead your body to, have that red flag. We also see that in dentistry. That one of the first signs is, is discomfort that brings a patient in, and they want that discomfort addressed. But why do they have that issue? We try to get to that root cause. We feel like as we've integrated our practices, we're nearly inseparable. We can't work without addressing systemic care and also addressing dentistry. They go hand in hand. There's a model of whole body care, which is body, mind, and spirit, because people are complete. We never see teeth just walk in our door. A whole person comes in our door. And we feel like the best model would be to help you reach your goals through treating your entire systemic body. The model for years, and it's that our country is still comfortable with, is that dentists kind of treat you from the neck up and the doctor treats you from the neck down. But we can't separate the two.
Yeah, the two pieces are connected, and things move between them. And I understand more and more because of the things that we experience together and the healing that we see in our patients. I understand how the model of care that I learned in school was really inferior and less than what actual people need. And we're all familiar with the diagnostic model of care, and it seems real basic, like this equals this. But I'll tell you, you miss a lot about people when you do a diagnostic model of care. And what that means essentially is that you come to me with a problem, I'm going to diagnose your problem and I'm going to offer you a solution to fix your problem. And that sounds pretty, true, but in reality it's not. In a diagnostic model of care, we're always problem focused. We're not ever in a creative paradigm of trying to have a vision for health or create something that's not there. Usually diagnostic model offerings are in the form of surgery or prescription drugs, which is really not very honoring to the body. The body has reached a certain level because of its environment or something that's happened with the body. We don't believe that just cutting away the body and replacing it with plastic or whatever different materials we would talk about is always the solution. Our first goal with patients is always to try to help prevent disease. I realized that I really had blinders on to the comprehensive nature of treating patients' health. When we talk about body, mind, and spirit, there are things that are thrown out. Like McDonald's will have a body, mind, spirit shake or something like that. But the truth is, this really plays out. When we go through the process that we go through with patients, it is very healthy for mind, body, and spirit. Mentally, we have a system designed to help generate patients' goals. So what we're doing is we're supporting what their vision is for themselves. And that's a very healthy concept for people. Spiritually, it's very healthy for people to know that they're taking part in a collaborative relationship towards their own betterment. They're part of the process. It's a very healthy concept, and we see this with people. The real gold in the situation is hidden down inside the patient. They've got this, I always see it like a rolling ball of energy that they've got, that God gave them to help focus on themselves and help themselves and have concern for themselves. But our process of delivering care takes that patient and their opinion out of that process. Our greatest weapon in our arsenal in fighting against disease is our patient. We get them real clear in their minds on what they're trying, we learn what is it that they're trying to accomplish. We help them to define those goals. And then we help go through a process of honoring their bodies in the way that we deliver care. Not destroying and replacing, but trying to honor their bodies in the process of delivering care. So I'm very, very, very excited about what we're doing in our practice. If you're the type of patient who is tired of feeling like you've abdicated the responsibility of your health to someone else and how they may be feeling that day or how decimals and documents go across on paperwork, you should give what we're talking about a consideration, because we believe it's the only honorable way to try to treat people.